facility within
mwena wa Naivasha kuria kuri na kigomano kia ruhonge rwa guthurima murimu wa cukari kwirikanite arwaru ingi murimu wa cukari makoretwo meyongereire ithabu-ini riri kumana na kwaga kuoya makinya ma guthimwo na kuringana na mwandiki mukaru thiini wa ministry ya motungata ma ugima wa mwiri Amos Olunga naguo thogora wa kuhonia murimu uyu gakorwo uri muhinga.
And we are very keen to work on what we call access programs, and we are working on access programs across the board, but four things that are important for us. One is among the non-communicable diseases, diabetes is key because of the cost of the medications. We want to reduce the cost of medications by around 50%, and we are working on an access program where the Ministry of Health will take lead in engaging with manufacturers of diabetic products and diabetic medicines so that then we can make this across the private and the public sector.
Ministry ya ugima wa mwiri yugite ni yaniriire mubango wa guthima tuhu muingi guthurimwo na kung'ethanira naguo oriri gicunje kia 54 hari igana kia arwaru a murimu wa cukari merikanite ni aria matathimitwo.
We've made a lot of progress in terms of information to the public on diabetes, and key among that progress is the 107,000 community health promoters. You will remember that the community health promoters have a bag, and that kit they have a glucometer, or the machine for measuring sugar, and they also get the strips. And this is in every single county. Every community healthcare worker has around 100 households.
Our mandate at Kenya Diabetes Study Group is to train these healthcare practitioners. Now, if we can be able to ensure the Kenyan is actually screened and diagnosed at the right time and then referred timely, we can reduce this economic burden.
Ruhonge rwa Diabetes Study Group rugite kwa ihinda riri kambeini yao nene ni uria murimu uyu ungigiririo no magathingata thirikari nayo etigirire kuri na ndawa cia kuigana kuri arwaru aya. Ngiribotera Inoro TV njitagwo Ani Ngige wa Nyamu.
The patient is stable and adherent. Is then